care home has begged for help as workers allegedly spent 10 days battling coronavirus symptoms in around 3/4 of their residents, according to the local MP. Labour MP for Hove Peter Kyle said it took 10 days for anybody to arrive to carry out tests on residents at Oakland's care home after the first suspected case was reported. He said staff had also begged for more personal protective equipment (PPE) in order to protect spreading the virus to other elderly and vulnerable residents. However, Mr. Kyle said the home never received the protective equipment and were left to simply wait for test results to return and hope for the best. Family members of residents in the home said they had been phoning to check on residents and finding nurse were breaking down in tears. Today, Mr. Kyle spoke about the situation at Prime Minister's Questions in the Commons, saying 14 out of the 20 residents had shown symptoms as well as 7 members of staff. Speaking about the situation, MP Mr. Kyle told the Mirror, "The first case was one resident that experienced signs, and by the time tests arrived there were 14 residents experiencing symptoms. There are also several members of staff self-isolating with symptoms. Let's say 14 people have it, that's 13 who may then have it unnecessarily, and the requests made for PPE on day 1 never arrived." In stark warning about the impact of the virus on the elderly, Mr. Kyle warned the new front line could move from the hospitals to the 80,000 care homes across the country. He said, "The debate so far has been centered around hospitals, quite understandably, because that's where the front line has been to date, but now it's making its way through our care homes. The new front line is going to be in the 80,000 care homes that stretch all 4 corners of this country. These are people who have served our country for decade after decade after decade. They have the right to dignity in their older years. The care workers in the home are angels, but this home has been put into state of shock." Mr. Kyle has said families of those residents at the care home are deeply concerned. Gisela Casiello, Rogers says his relative has been sick at the home for over a week. He told the Argus, "It is war zone in there. The situation is critical and staff are diminishing by the day." On Friday, one of the nurses was in floods of tears as they have had no help. They rang 111 but no one answered. "What can we do? Sit here and watch the residents die because staff are not getting the help assistance they need." Mirror Online has contacted the nursing home and the Brighton and Hove Clinical Commissioning Group. Meanwhile, NHS staff have claimed their lack of PPE have left them feeling like cannon fodder as they have no choice but to treat patients without correctly protecting themselves. However, the government has told hospital trusts they will be receiving deliveries of personal protective equipment (PPE) around the clock, with the army being brought in to support the supply chain. NHS England said millions more items of PPE had been delivered over the last few days to hospitals, ambulance trusts and care homes among others. It follows letter in the Sunday Times from almost 4,000 NHS workers who called on Prime Minister Boris Johnson to protect the lives of the life-savers and resolve the unacceptable shortage of protective equipment. The group said many medical workers are putting their lives on the line every day by treating coronavirus patients without appropriate protection, and they called on Mr. Johnson to ensure an adequate supply of masks, safety glasses, gloves, aprons and protective suits.